Distinguished guests, dear participants, I would like to welcome you all and take this opportunity to express my gratitude for the great enthusiasm you have shown in this webinar on the topic of financing gender-responsive social protection from across the continents. Why have we organized this webinar? This webinar is organized in the framework of the global program on synergies between social protection and public finance management, funded by the European Union and implemented jointly by the ILO, UNICEF, and the Global Coalition of Social Protection Flows. The program approach is to support evidence generation based on state disaggregated data and provide technical advice to ensure national social protection programs can play a key role in responding to the specific needs of boys and girls, men and women, while reversing the gender imbalances through social protection laws and programs, including linkages to complementary social and employment services and access to information. The program focuses also on adequate funding for breaking the cycle of gender inequality that trap women in informal and low-paid jobs without adequate social protection. Rather than promoting improvement of social protection in isolation, the program considers social protection policies in the context of poverty reduction, employment, formalization, care, migration, and other macroeconomic policies. The program seeks also to address multiple factors leading to the marginalization, including disability, race, migration, sexual orientation, etc. As part of its knowledge exchange and communication initiative, the SP and Public Finance Management Program is organizing a series of webinars to learn from country experiences and contribute to the international debate on innovative solutions to increase financing and improve public finance management for strengthening national social protection systems to achieve universal coverage for all. It is in this context that we have invited to this webinar high experts and speakers from the European Union, UNICEF, ILO, from the headquarter offices and country offices as well, to share with us concrete experience, results, lessons learned, and perspective. Allow me, dear participants, to introduce to you today's speakers and presenters. First of all, we have Dorte Bos. Bos is currently the head of Sector for Horizontal Coordination, Social Protection and Disabilities at European Union Directorate-General for International Partnership. She has worked for over 20 years in development policies and international cooperation. Previously, she led various teams in international partnership headquarters and in delegations covering human development, communication and visibility, finance, and contracts. Before joining the European Commission, she worked in the Latin America Department of the German Ministry of Economic Cooperation and Development. Dorte holds several master's degree and postgraduate degrees from various universities in Madrid and Germany. The second speaker is Lauren Whitehead, Social Protection and Gender Lead at UNICEF headquarters in New York. She oversees a global portfolio of work strengthening gender-responsive social protection with colleagues across more than 150 countries and territories UNICEF serves. Previously, she was Chief Technical Specialist for the Generation Equality Action Coalitions at UN Women, overseeing delivery of thematic coalition between governments, UN agency, international financing institutions, foundation, private sector, and civil society to accelerate progress toward SDG 5 that you know well on gender equality. She has also worked with the UNHCR, Asian Development Bank, Inter-American Development Bank, and various nonprofit organizations in Asia, Africa, and Latin America. Thirdly, we have Fabienne Shana, currently Technical Officer for Social Health Protection for Refugees and Host Community for ILO and UNHCR for the Prospect Project, and she's based in Nairobi. As the program regional specialist, she covers many countries in East Africa, including Kenya, Uganda, Sudan, Ethiopia, but also Egypt in Northern Africa. Shana has a decade of experience working on social health protection, having worked for the World Health Organization and GIZ before, and mainly in Southeast Asia. During her work in Asia, she advised the Cambodian Ministry of Economic and Finance on the new national social protection strategy and developed approaches to include persons with disability into Cambodian health system. Thirdly, we have Nakalo Sali, fourthly, Nakalo Sali, social policy officers at UNICEF Uganda. She has over 9 years of experience in social protection and is currently based in Kampala, where she leads UNICEF's first urban social protection program targeting adolescent girls. Her work is to help to ensure that vulnerable adolescent girls in the city of Kampala that are in and out of school receive education and skilling, that they are empowered to achieve their goals and transition safely to adulthood through providing them with cash transfer, mentorship, and referral to health, education, and protection services. On this note, I would like to recall you that we would be giving each presenter about from 10 to 12 minutes of presentation, and then this will be followed by Q&A and closing remarks for 20 minutes. How to share your question to the speakers? We advise you to type them in the Q&A box of Zoom. And also, please state your name and the name of your organization. And if your question is directed to a specific speaker, please do specify it. As you are invited to interact with us on Twitter using #SP.org webinar. You have received the information before. On this note, I would like to welcome the first speaker, Ms. Dorte Bose, to give us her opening speech. Ms. Bose.
Thank you very much, Uziel, for the introduction. Look, I will just a second. So good afternoon, good morning to everyone. Welcome to this webinar on gender-sensitive social protection. So this is in fact an event which is most momentous as to commemorate the International Women's Day, which was yesterday, as we all know. So it comes in very handy to have this seminar here today. The webinar, as already mentioned, is part of the EU's global project on improving synergies between, on one side, social protection and public finance management on the other side, financed by the European Union and implemented by the ILO, UNICEF, and the Global Coalition for Social Protection Floors, as already mentioned. So the European Commission has been supporting or financing this program since 2019. We are almost coming to its end with the aim of strengthening social protection and better integrating it in national budget cycles. So the program's overall objective is to support the advancement towards universal social protection following a leaving no one behind approach. This entails, of course, that we need as well to have a specific focus on groups facing particular vulnerabilities with the aim of extending access to adequate, inclusive and sustainable social protection. It is in this sense, it's one of the programme's key objectives as well, is to support partner countries in developing gender-sensitive social protection strategies through building blocks of analysis, policy and programme design, finance and implementation. Actually, we are working with altogether 24 countries, which, as I said, it's a broader context on bringing together social protection and public finance management, but with a special eye as well on gender-specific experiences and policies. I'd like to name 3 countries here where we have looked specifically in gender-responsive policies and social protection. This is Nepal, Angola, and Uganda. So I'd like to focus on 2 main points in my short introduction here. So first point is, what are the challenges in females' access to social protection? So equitable access to gender-responsive social protection has a significant impact on women's rights, women's and girls' empowerment and opportunities, as we all know, with a wider effects on their families and communities, including men and boys. However, social protection systems very often fail to address the intersectional risks and vulnerabilities that women and girls specifically face, further accelerating gender discrimination and inequality. And as a result, women are often excluded from social protection schemes. You all know this. So this has to do with the accumulation of various life cycle vulnerabilities. Girls, as an example, are often at risk for school dropout and early pregnancy. During their working age, women's careers are characterized by lower market participation, by fewer years and interruption in paid work, more part-time and informal jobs with often no social protection arrangements and lower earnings. This partially reflects women's higher burden of unpaid and domestic work. To this, we should add increased vulnerabilities associated with health risks, associated with pregnancy and childbirth. Yeah, and perhaps as an example, with maternity coverage rates ranging from 14% in sub-Saharan Africa to only 50% in Latin America as well, and their lack of access to economic assets, including land, capital, and credit. Last point under this chapter on main challenges is that all of these barriers have a determinant influence on women's contributory capacity, of course, increasing vulnerability in old age and taken into consideration, which is becoming more and more problematic given their longer life expectancy, so of women, and resulting in gaps in social protection coverage across women's lives. A second aspect here I wanted to highlight, apart from the main challenges of women to have access to adequate social protection coverage, is what we are doing at the policy program level. So what could be a possible response? So as a response to those challenges, a key element, first of all, is to have an overall gender-sensitive approach, which starts with data. So we need to promote social protection strategies that address women's specific circumstances, risks, and vulnerabilities. And the key answer in the first place is sex-disaggregated and gender-relevant data. Then the second point under the policies and programs we would propose is to ensure adequate social protection for women during periods of sickness, maternity and unemployment without penalizing women's specific work care trajectories, which is a reality. This can be done through the establishment of non-contributory maternity benefits, for example, income replacement schemes and old age pensions, or compensating for time dedicated to unpaid work and care, for instance, with pension credits to bridge the contribution gaps. Almost coming to an end here. So this is as well promoting shared responsibility for care, for instance, by providing paternity leave or avoiding cash transfers, conditionalities which pose a higher burden, obviously, for women unpaid care work. And another possibility would be as well to combine social protection with access to quality public services, for example, including childcare, labor market programs, and protection from gender-based violence, where social protection can be a vital lifeline, as was underscored during the COVID-19 pandemic. And last but not least, this project also has a strong focus on promoting and facilitating dialogues between governments, social partners, and civil society to combat discriminatory social roles and pledge for adequate and sustainable social protection coverage for women. So before closing here, I'd like to highlight, and this is important, that the European Commission, under its new financial instruments, the so-called NDICI Global Europe, this is our 7-year budget, which includes, of course, the budget for external cooperation. We have an aim that we address that 85% of all our cooperation programs need to contribute to gender equality and women's empowerment by 2025. Though this is important, this is part of the regulation. And this is part as well, by the way, of the Agenda Action Plan 20, which was the communication on GAP3's Gender Action Plan of the European Union. So finally, beyond this very the specific seminar, the program has not only delivered concrete results, but has also produced an enhanced body of evidence, and this is important, and tools to support decision making, to kind of design better programs in social protection for women and girls. This experience and products will be showcased at the program's online closing event, which will take place at the end of June this year. Then I'd like, and really coming to my end here, I'd like to refer to a group, a public group we have on social protection on our so-called Capacity for Development website, where we upload all our most recent policy documents, and we invite you as well to post your updates, experiences, and tools. So we will share the link in the background in the chat here as well. By my colleague will do this, Alba Riobosotto. And then last but not least, I'd like to extend a big thanks to UNICEF, the ILO, and Global Coalition for Social Protection Floors for organizing this webinar and being our very trusted partners who helped us to implement the overall program. So I wish you good luck to today's seminar, and thank you very much for listening.
Thank you very much. Thank you very much, Dorte, for recalling the program objectives, the main challenges, the approaches, and the major results achieved so far. Now I would like to invite Lauren Whitehead. Lauren, welcome to you.
Thank you so much, and very wonderful to be here, colleagues. Sincerely appreciating your time and your attention to this very important topic, as Dorte has just mentioned. I will go ahead and move directly into this presentation for now. So as was previously mentioned, my name is Lauren Whitehead, and I'm the Social Protection and Gender Lead for UNICEF, based in New York and HQ. And so for this presentation, I'm looking to just give a bit of a framing for the panel discussion that will be taking place around what can be achieved through gender responsive social protection. And I know we've had some overview from Dorte, so I'll look to complement what was just shared, in terms of how this area of work can be expanded. I think it's helpful to set the scene recognizing some of the limitations and challenges around gender responsive social protection to date. For example, recognizing that during COVID-19, we only saw 1 in 5, around 20% of social protection measures that specifically address any forms of gender inequalities, despite the fact that we recognize that COVID-19 had a disproportionate impact, particularly on women and girls, largely due to increases in unpaid care work and burden, as well as some of the wider ramifications of the pandemic itself on health and other considerations. We recognize as well that this issue is actually compounded for caregivers such as mothers of children with disabilities, specifically given some of the needs of that population and the greater difficulties faced during COVID-19. Only 1/4 of children globally have access to any form of child or family benefits that are provided, which again creates a foundation with a lack of security, income security and financial security for households, and for the human capital development of those children therein. We recognize as well that was mentioned that more than half of global mothers are deprived of maternity benefits, which has significant ramifications in countries around the world, but particularly recognizing that that number is significantly higher in low and middle income countries. We also recognize that just over a quarter of working age women are covered by a pension compared to almost 40% of men, which has significant impacts on the long-term and future welfare of that woman, and in the case of mothers, women with children as well, and their inability to ensure that they will have a stable financial future. And then finally, just to recognize that as a group, women, children, and people living with disabilities sustained some of the greatest setbacks that we witnessed during COVID-19. However, many programs fell short of being gender responsive and truly inclusive. And so part of what we're hoping to frame in this webinar today is the fact that we know that this gap in gender responsive social protection programming is great, but the potential for what this work can do is even greater. So to start with, I'd like to just reflect very quickly on what should gender responsive social protection do for different segments of the population. And to start with, looking at women, adolescent girls, and young girls. So for women, we recognize that there is a significant set of barriers that women face in terms of being able to work. Some of that comes from the unpaid care work that they take on. Some of that comes from discrimination in employment and in the job market. We recognize that when women do have jobs, especially in low and middle income countries, they are highly concentrated in the precarious informal sector. And even when they are working, they do tend to take time off for these periods of work interruption for childbearing and child rearing responsibilities. We also recognize that they tend to face high levels of domestic violence, which does link to economic security, particularly in the inability to leave situations of domestic violence, but also in the inability to work and continue to be productive, often due to controlling environments and situations. Similarly, we see for adolescent girls a significant portion of their time that is spent as well on unpaid care work, recognizing that on average, globally, around 40% of the time of young girls is given to unpaid care work compared to young boys. We recognize that there are also significant barriers to education, that there's significant threats to her bodily autonomy, especially in terms of reproductive health and menstrual health and hygiene, and a high risk for early marriage and therefore early pregnancy as a result, and similar impacts related to domestic violence. And then for young girls, we recognize similar barriers to education, similar commitments to unpaid work. It's estimated that around 160 million hours globally is spent by young girls on domestic work. But we also recognize gender preferences in households and neglect of young female babies, and issues which leads to issues around food insecurity, malnutrition, and hunger. And of course can lead to child marriage to reduce one more mouth to feed within the household. We also recognize that there's high risk of sexual abuse, in addition to some of the domestic violence risks that we see for women and adolescent girls. However, when we talk about gender responsive social protection, we aren't necessarily just speaking of women and girls. We do have to think about gender responsive social protection across genders, which includes, of course, boys and men, who similarly face risk that social protection is able to support in a truly equitable system. So we see higher rates of child labor among young boy children, and we see barriers to education created by that in case of needs to generate income for a household. We see patriarchal expectations and toxic masculinity confining young boys and then eventually men to certain roles that they're expected to play, such as, for example, obligations around being a breadwinner in the household, even in cases of economic insecurity where it is not likely or very nearly impossible in some cases to sufficiently provide for a family, and also a high concentration in the informal sector in a greater number, but though a smaller percentage of the male population as a whole. And we recognize some of the detriment of stigmas and taboos, particularly around child rearing and participating in domestic work and domestic life, which then has ramifications as well for women and girls. And we recognize that instruments such as parental leave, for example, within social protection has a tremendous role to play. So then what does this mean if we think about these issues, as Dorte mentioned earlier, around intersectionality of these same populations? So you can have women and child-headed households facing all of the same constraints that I previously mentioned, in addition to added vulnerabilities due to their intersectional identities. For example, an increased difficulty to work, especially with high dependency ratios, lack of access to proper information about services and entitlements, dependence on exploitative relationships in particular in order to meet their financial needs and welfare, child marriage and early pregnancy at higher rates we see, and very high levels of poverty within a household. Similarly, if we look at age, for example, elderly women and elderly populations, as well as people living with disabilities, we also see added risk of difficulties to work, access information, limited mobility, and dependence on exploitative relationships, in addition to barriers around physical communication and attitudinal issues, and again, higher levels of poverty. And then we think as well about indigenous, and migrant populations who face another whole set of challenges around similar things, but also including stigma and isolation within communities, lack of protection under the law, and specifically a high impunity for crimes that are committed against them, marginalization, and ostracization. And one thing to underscore here in all cases, looking at intersectional identities, is higher levels of poverty within a household or a community for those who are considered marginalized, on top of being adolescent girls, young girls, women, men, and boys. So when we speak about gender integration into social protection, we look at this typically across a continuum. And I think everyone who is here today is here to understand ways in which we can help advance the promise of gender responsive social protection across the continuum. So the continuum begins with gender discriminatory social protection, which may in many different ways, unintentionally often, take advantage of gender stereotypes and reinforce those gender inequalities. That can be something along the lines of social protection programming, such as cash programs, cash transfer programs, or public works that are conditionally based and require specifically that mothers have to take on additional responsibilities in health and education for their children. That is leveraging the gender stereotype of the mother as the caretaker, for example. We have programs that are gender neutral, which ignore gender roles and norms and how those roles and norms might affect certain populations. For example, contributory pension schemes, which largely benefit those who are in formal employment, despite the fact that a high concentration of women in low and middle income countries is in informal employment. And then as well, the fact that women experience periods of interruption of work and employment, which then affects their ability to access a pension later in life. We also see programs that attempt to address or acknowledge gender differences, but don't necessarily prioritize specific needs as being gender sensitive, such as those that take GBV, gender-based violence risk analyses, but don't specifically address proactively some of those needs that come up in such analyses. And then in the case of what we're speaking about today, in many programs that can move from being gender responsive to ultimately being gender transformative, which is really a pivotal shift from responding to the needs of different genders directly through program interventions, through policies that are set, to actually deliberately changing and tackling harmful gender stereotypes, gender norms, gender roles, and structures within a society. So the difference between, for example, messaging, labeling, and information around gender-specific health needs that may be faced, reproductive health, for example, for women, that's targeted towards women and girls, versus actually looking to change social norms through something like, for example, a Cash Plus program that might both tackle income poverty, as well as increasing joint decision-making, joint household power within a household, for example, through household trainings and partner dialogues with spouses. So before I close, I just wanted to share just a few examples of what this might look like in some of these different classifications, as we're thinking especially about the programs that will be presented on today. So for example, if we looked at the Productive Safety Net program, in Ethiopia, there's some aspects of this program that will very strongly be considered gender sensitive. And that is particularly because there are elements, such as in the Public Works program, which specifically tailors certain public works opportunities and livelihoods to women, for example, offering periods of absence from work for public works due to childbearing responsibilities for mothers, and also offering opportunities for maternal and child care needs within the public works program specifically. So less intense labor requirements, greater schedule flexibility for women who have child caretaking responsibilities, et cetera. And we've seen that this program has had a significant, as many of you know, impact on food insecurity and even recovery of households from shocks, including COVID-19, and has been able to be scaled to respond to conflict and crisis, especially including internally displaced populations. However, with those conditionalities still in place around a public works program such as SP&P, this is something we would strongly consider to be perhaps gender sensitive. If we look at the opportunities that the basic social subsidy program in Mozambique afforded. That program looked to leverage a cash plus intervention, whereby households received unconditional cash for children under 2, but also received social behavior change communication and WASH training, in addition to training around how to care for a child. And these were specific interventions that were tailored to needs that were recognized for women in the community who were becoming mothers. So as a result, we saw a sharp increase in birth registration so that children would be able to access services, increase in dietary diversity and frequency of meals for those children, decreased stress, depression, intimate partner violence, and an overall reduction in pregnancy as well. And this program would potentially be considered gender responsive. And then I'll close with one last program example to share here, which is around the Productive Social Safety Net program in Tanzania and a cash plus intervention that was added to that particular approach called Ujana Salama, which means safe youth. And that program specifically targeted adolescent girls and boys with training on livelihoods, as well as SRH and HIV life skills, so sexual and reproductive health and HIV life skills. And as a result, not only did it have certain health and reproductive health outcomes around increased HIV testing and health visits, it also delayed sexual debut, which is a first sexual engagement for adolescents. It reduced violence and depression, and it increased HIV prevention and contraceptive knowledge, but very importantly and transformatively, it changed gender equitable attitudes between adolescent girls and adolescent boys about sexual activity and sexual and reproductive health. So that is a truly gender transformative impact that we would hope to see from programs. So ultimately, as we move forward today, we'll just be looking at what kinds of outcomes can really be achieved through gender responsive, gender transformative social protection programs, such as those that have been supported by the program. And we hope that what we'll be able to share through these examples is showing how gender responsive and transformative social protection can drive equitable gains by leveraging inclusivity for all genders to benefit from through a true investment in leaving no one behind, how it can lead to a progressive realization of social protection that meets the needs of all. So moving in the direction of universalism of social protection, how it can help reduce feminization of poverty and the intergenerational transmission of poverty, which tends to happen from mothers to their children, strengthen income and economic security and stability, improve social cohesion, and address the disproportionate care burden, and ultimately achieve gender justice for all. So thank you very much for your time, and I look forward to the Q&A after this discussion.
Yeah, thank you so much, Lauren, for recalling that there is a great gap between men and women as far as social protection coverage is concerned. You have recalled also the major challenges, the issue of intersectionality of women vulnerability. You shared with us also the aspect of the continuum, the integration continuum, and some concrete outcomes and results. We are looking forward for the Q&A part. While we are waiting, I invite Ms. Shana Huhle for her presentation. Shana, welcome.
Yes, hi. I hope you can see the presentation. Can you just confirm that you can see it?
Yes, I confirm.
Perfect. Okay. Yes, good afternoon. My name is Shana Huhle. I already was introduced, so I'm just going to start straight with my presentation. Today, I would like to speak about comprehensive maternity protection in Kenya. We have been designing a maternity cash benefit for women, specifically for women working in the informal economy. And I would like to just give that as an example of a gender-sensitive social protection program. So I'm just going to quickly give you a situation on Kenya, both on maternity care, so healthcare, and also on the maternity income, so both aspects. Then a little bit on the challenges and opportunities for expanding coverage under this program, and then lessons learned and discussion. So first of all, I wanted to show you the social health protection schemes that are in place. So the National Health Insurance Fund, NHIF, operates several different schemes or packages, and packages both, for the population. So if we look at the percentage here, the percentage really just shows how many pregnant women are currently part of which scheme. So the enhanced scheme of NHIF serves civil servants. Then you have a scheme for formally employed workers. Then you have the NHIF voluntary scheme, which means all households in Kenya can enroll voluntarily and then pay 500 Kenyan shilling, which roughly translates to $5 per household per month to join NHIF and have the normal NHIF benefit package. And then there's the subsidized schemes for poor and vulnerable groups. So these are the normal health protection schemes, while at the same time NHIF with the government of Kenya operates also a program called Linda Mama, which you can just enroll via text message and is free, and all pregnant women who are not already covered by NHIF can enroll and get free prenatal care, delivery and postnatal care. So if you can see at this point, when we look at the income protection, only around 5% of pregnant women fall under the formally employed or civil servant scheme and are therefore also by law entitled to receive maternity income, so paid maternity leave basically through the employer. At the same time, we can see that at the moment, 76–77% of pregnant women are accessing one of the schemes that are available to them. But we can also see that the Linda Mama scheme really drives this number up with 65% of all women in Kenya accessing healthcare during their pregnancy and for delivery through the Linda Mama scheme. So this is just to give you a short presentation on the architecture that we have here and what we've been working with. So when we look at healthcare, first of all, despite efforts to expand coverage, and as we've said, that all women can enroll voluntarily into Linda Mama, there's still an estimate of around 23% of women delivering that are not benefiting from any sort of financial protection against the cost of prenatal care, delivery, and postnatal care, right? At the same time, as I said, only 5% of pregnant women are entitled at the moment for paid maternity leave because they're in the formal sector operating there. So there's no public mechanisms for income support during pregnancy or after birth for women, for 95% of women in Kenya. And even workers in the formal employment or in the formal, informal employment can only rely on their employers. So it's based on employer liability, which also creates a risk for discrimination in the workplace. It's difficult to be enforced. And if the employer refuses to pay, a woman would have to sue their own employer, which often leads to rather women foregoing their paid maternity leave. So when we have this architecture, we have two different options that we've discussed here in Kenya. The one is to attach the benefit to the current NHIF scheme. As I said, it's around 76% of women are currently already accessing one of the schemes. So we have quite good data on them. On the other hand, it has, of course, also disadvantages to use those schemes. So I'll go into the opportunities and disadvantages afterwards. The other option would be a universal benefit, either for all women in Kenya with a fixed amount and employers top up, or it could also be universal benefit excluding the formal sector if the data allows us to do so. There could be also conditionality on being enrolled in NHIF or Linda Mama, so meaning everybody is free to access this benefit, but at least, of course, then the benefit, you would have to join Linda Mama at least, which is free of charge, right? So you don't have to pay for it, but you would have to be enrolled in some of the systems. So the opportunity, or well, first, the first point is actually more fact, is that women are, as the previous presenter has already said, mostly employed informally and spend considerably more time on unpaid care work. So we just have to highlight again the importance of affordable, adequate and accessible public services, especially childcare, but also healthcare. So the opportunity here is linking maternity income support or the cash benefit to existing schemes. And this could also then increase in turn the social health insurance scheme enrollment. So that means that either women would enroll into NHIF and their whole household would be covered in case of sickness, or the Linda Mama scheme at least, and they would at least have an attended birth and prenatal and antenatal care. So that would hopefully also reduce maternal and child mortality. Then we hope that the maternity cash benefit would also increase exclusive breastfeeding, which is currently around 60% estimated by UNICEF in Kenya, because women have the opportunity through getting some income support to stay at home for a longer duration. One of the opportunities is that NHIF has recently passed a bill that makes social health insurance mandatory for the entire population. So over time, we're moving into this direction anyway of getting all people somehow registered or enrolled into NHIF. And we have this online payment system in Kenya, which is called M-Pesa, which really simplifies channeling funds to the beneficiaries. Challenges with a lot of consultations that we've done with stakeholders, regardless of basically where who we have consulted, males have very often responded that they don't want to pay for the maternity cash benefit. So this whole principle of solidarity and risk sharing was not really accepted. Then workers and employers in the informal sector really resist a transition out of employer liability. Workers are afraid that the level of the benefit would decrease, and employers are afraid that social security contributions would increase, because of course there are several benefits being developed at the moment in Kenya. And financing any social protection program in Kenya will require fiscal space, especially for women in the informal economy that cannot or can only limitedly do contributions for this scheme in an environment that is already highly constrained and has a lot of contradicting priorities. We have also a universal child benefit that is currently being piloted and so on. So of course, it's also a matter of priorities and fiscal space. So I'm just going to go quickly into the lessons learned to not go over my time. So we had all these different scheme designs. As I said, there is an advantage probably to linking this income support or cash benefit to existing healthcare schemes. Because we have NHIF as a partner, which provides the infrastructure and has all the data already. And it can really incentivize enrollment into healthcare schemes. But at the same time, we have to be very careful that we don't, because we do risk to reproduce coverage gaps and reinforce complex financing architecture, which is already existing. And even if we would introduce this using the current schemes, it might retain the employer liability provisions that are currently in place for the formal economy. So just to summarize, we've done a previous costing, which we'll have to update, but we estimated that it would cost between 0.4 and 0.7% of GDP to implement this maternity cash benefit for Kenya, regardless of the design. It could increase social health protection coverage. It could also extend maternity care to those missing 23%. It supports women financially and will help them to recover after birth, which currently 95% of women do not have any entitlements to, also not in the law. And it is a chance to at least have a discussion to move away from employer liability, which we see as very often leading to a lot of discrimination in the labor market. So this is it. Thank you very much for listening, and I'll mute myself. Thank you.
Many thanks, Shana, for this presentation around the comprehensive maternity protection in Kenya, where you have exposed the situation in the country, the challenges, the lessons, the current situation of the NHIF scheme and the Linda Mama scheme, the opportunity, and you have finished with the lesson learned. We are expecting more questions after the last presentation is finished. Let me invite the last but not the least presenter, Nakalo Sali. Nakalo Sali.
Yes,
Nakalo?
thank you so much.
Yes.
Yes, you hear and see me?
I see you perfectly and hear you.
Great. Good morning, good afternoon to everyone. Thank you so much for being here, and I'm happy to share Uganda's experience implementing an urban social protection program targeting adolescent girls in Kampala. Our program is called Girls Empowering Girls program. Now, in way of providing some context, Uganda has only about 2.9% of the population being covered by at least one social protection benefit. And this is prior to the COVID-19 pandemic, which is well below the African average of 17.8%. Now, poverty remains really high, but also disproportionate amongst the regions, different regions of Uganda, and gender, leading to stark inequalities and with a Gini coefficient above 0.4. We have 39% of the population in Uganda in the subsistence economy. So this really contributes to the high levels of poverty that we have in our country. Now, when we come to the urban city, for Kampala particularly, we see that poverty is consistently higher, especially amongst children compared to the other populations. We have 44% of children in Uganda who are multidimensionally poor, with very limited access to essential social services in health, education, protection, wash, and this presenting fewer prospects for better economic opportunities. Now, in introducing the program that I'm going to talk about, research and evidence showed that adolescent girls specifically experience greater vulnerabilities, especially in the urban context compared to the rural areas. These unique challenges and vulnerability include sexual and gender-based violence, a higher risk of HIV infection than their male counterparts, teenage pregnancies. We see that 1 in 4 girls aged 15 to 19 have already begun childbearing, and this number is increasing. We have very high levels of school dropouts, with an average school dropout rate of about 45%, but this is much higher amongst the girl child. And the COVID-19 pandemic presented even more challenges when it came to school dropouts and re-enrollment after the COVID-19 pandemic. There's also a challenge of child marriage, which specific regions in Kampala do face more than others, but that is one of the challenges that adolescent girls face. Now, zeroing in down to the Urban Social Protection Program targeting adolescent girls, the objective in designing this program, together with government through the Kampala Capital City Authority, which is the authority in charge of the city, the objective was to ensure that girls transition safely into adulthood with greater inclusion and protection through strengthened socioeconomic prospects. Also to see that adolescent girls receive education and training, but also that they are empowered to achieve their goals and become productive citizens. Now, our target group, there are 2 categories that this program targets: adolescent girls in primary school, in universal primary education, especially those schools in the city with the highest levels of dropout, but also in catchment areas with the highest levels of multidimensional poverty, child poverty. We are also targeting adolescent girls who are not in school, and these are aged between 11 to 15, but also living in the areas with the highest levels of multidimensional child poverty. Now, we have 2 cohorts that this program is managing. The first cohort, which was enrolled in 2020, and the second cohort, which has just been brought on board, of another 1,500 girls that split between in and out of school, that was enrolled in 2022. Now, this program pays specific attention to specific vulnerable groups of girls with compounded vulnerabilities in an effort to leave no one behind. In our efforts to build an inclusive social protection system in Uganda, our program specifically makes sure that we're intentional in getting girls, looking at the issues of disability. We do enroll girls in the urban setting. We do have urban refugees. And especially after the COVID-19 pandemic, where we saw a spike in the number of girls who are pregnant, the teenage girls and teenage mothers, the specific attention that's paid to this particular group of girls. Now, the program has 3 pillars, and these are referral to services, and these are health, education, and protection services, providing opportunities through a cash transfer, which is on a monthly cash transfer given on a termly basis, in our cases as per the school calendar, and also mentoring through a network of peer mentors. These are the 3 main pillars of this cash plus intervention. Now, going a little bit deeper into the 3 pillars, I'll speak about the first one, which is mentoring and skilling. Through a group of mentors, like I said, each girl is attached to a mentor. Each mentor has about 15 girls, and they have one-on-one and group mentoring sessions that happen in a month. And this is engaging them through different topics throughout their 4 years of the program, but also equipping them with skills, life skills, foundational skills, and 21st century skilling. The other pillar is on referral to services, like I said, health, education, protection, and this is due to the vulnerabilities that these girls face in the city. We have seen that many of our girls, especially during the COVID-19 pandemic, there was a demand for services when it came to reproductive health, in access to justice, especially in cases of sexual and gender-based violence, and also for girls who are out of school, demand for services such as vocational services and referral to spaces where they can get skilling. Now, the last pillar that I'll also talk about is the cash transfer, and this is an unconditional cash transfer that is given to the adolescent girls. Now, for those who are in school, they get about 40,000 Uganda shillings per month, which comes to around 480,000 shillings per year, which translates into $130. And this is given on a termly basis, like I mentioned before, and we transfer this money through mobile money. But because these are beneficiaries who are below the age of 18, we do register their caregivers who receive this cash on their behalf, but work with them to see that this cash is used to the benefit of the adolescent girls. And for the in-school girls, yes, it's unconditional, but through the mentoring, we do want to see this girl stay in school, but also transition from primary to secondary education. Now, for those who transition to secondary school, they do get a top-up of 20,000, so it increases by 20,000, and they get 60,000 shillings per month instead, which translates into about $195 per year. Now, the out-of-school girls also get the same, except that they don't get a top-up for secondary education unless they opt to re-enroll back into school. Now, you might be surprised, but for one reason or another, there are adolescent girls who opt not to return to school for one reason or another. But this program does everything it can through the mentoring, through the skilling, to see that the girls are supported to go back to school where possible. In terms of the cash transfer also and the disability focus that the program has, we do provide a 50% top-up on top of the cash transfer for the girls with disability. In terms of some of the achievements that we have registered since the program started in 2019, we have doubled the number of girls, starting from 1,500 to now 3,000 adolescent girls in the in and out of school category. And also the inclusiveness that I have mentioned about, having the disability focus, it being intentional about including refugees, but also the teenage mother aspect. We have developed a management information system for the program that is going to be linked to the National Single Registry. And this is really part of our system strengthening agenda. One of the key achievements that we believe we have registered is this program is completely led by government. And by government, that is through the Kampala Capital City Authority. This has been very well established within the ecosystem. It's a multi-sector approach in terms of implementation of this Cash Plus program, where we see about 4 different departments within the government authority coming together. This program is led at the gender unit of KCCA, but we also have the education team, the public health team, and Treasury, who manage and lead on the cash transfer coming together. Now, we have a few reflections and lessons that we wanted to share, particularly, for our experience, to share what it means implementing for the first time a gender-responsive social protection program in Uganda in the city, in an urban setting. We get the question a lot, how about the boy child? Yes, our intervention looks to target adolescent girls because of their unique challenges that they face. But many times they say that, yes, the boys, they also have needs, they also face challenges. And this is something we're reflecting on. Yes, whereas our program does engage boys, we have boy champions, but as we advocate for universal inclusive social protection programs for the country, we're very mindful to see that we ensure that inclusive gender responsive social protection programs are designed, whereas of course, such particular programs like these are targeting girls for a specific reason. We are also looking to see that extension of programs such as these is done. We're only covering, our beneficiaries are only about 3,000 adolescent girls, which is approximately 3.2% of the adolescent girls in need, and that is in Kampala alone. This is before we look at other cities in other regions of the country. We're also mindful that there's very limited fiscal space. We are in a context where government spending on social protection, on direct income support is low compared to other countries, with less than 0.3% of our national budget being spent on social protection annually. And just to mention that in the coming financial year, 23-24, this is set to even go lower. One of the reflections that we have from implementing this program is that we've seen that government-led initiatives are easier to integrate and also scale up. We see that the level of ownership and commitment from government, but also we have seen that currently, as Uganda is designing the social protection strategy for the country, we are seeing that such programs that have produced an evidence base for gender responsive social protection for children, for child-sensitive social protection programming. This is actually being pitched at that level to capture this in the strategy. We've also seen that integrated cash plus interventions achieve better outcomes, working with different sectors to be able to deliver a package of services to beneficiaries, including cash. We've seen a number of good outcomes when it comes to that. And then when we develop a management system for the program, it's really essential to link it to national systems for sustainability purposes, but also for ownership for government. Lastly, this program, we saw during COVID-19 that this program, really supported girls to be able to cope with the shock and the challenges, and also not to resort to bad coping mechanisms. Like I said, the COVID-19 pandemic presented lots of challenges, and in the urban setting where there was no food, children were not going to school for nearly 2 years in Uganda. That's when we saw the spike in the number of girls getting pregnant. We saw girls being forced into marriage. But with such interventions, if they existed to cover many more girls, they would be able to cope with such shocks that happen. In conclusion, we believe that gender responsive social protection programs can be a strategy that will contribute towards building an inclusive social protection system. Thank you very much.
Sorry, thank you so much, Nakalo. I think we are running short of time. We are left only with 30 minutes. I would like to take this opportunity to look into the questions that have been asked through the Q&A box. So when you were talking, presenting, I managed to capture some questions that I'm bringing back to the presenters. Feel free to respond to the question you wish to. The first question is from Fiona Clark and Ghislaine Saizonu from ITUC Africa. They have appreciated the slide on intersectionality, but they see that there are some issues that are not sufficiently covered. For example, LGBTI plus and sex workers. Do you have some examples on this issue, Lauren? And also there is another question. What are the challenges that you face limiting the government to lead SSNPS by Naheem Ferdows? The second question is by Rose Wild. How can NGO support awareness and uptake of these national entitlement as an integral approach? The following question is by Sykes Type. Given the challenges with financing social protection, do you have some good examples where government have managed to create fiscal space? Almost the same question is asked concerning what are the barriers that prevent sustainable gender responsive social protection, including the financing one. So, and lastly, for the presenter from Uganda, is this scheme, Girls Empowering Girls, totally financed by the government, or it is through a pilot project? Those are the few questions I have captured. I will look into the Q&A if there are others. In the meantime, you can start responding to those questions. Let me start first with Lauren, please. Lauren?
Wonderful. Yes. Can you hear me?
Yes.
Okay, wonderful. Thank you so much. And very, very much appreciated for the questions. And I don't know if my colleagues, Alan and Shanna, would like to also answer some of these as they've come up. I'll attempt to tackle some of those that you've just mentioned, but please let me know if I miss any. On the question related to other marginalized populations, for example, LGBTQ I+ populations, as well as sex workers, for example, there are a number of programs, or there are a few programs that have attempted to address the needs of these populations. And I apologize for not actually including that on the slide on intersectionality, because that should have been there. It is a more emerging issue, and it is one that I think many governments don't necessarily feel as equipped to handle, even less so perhaps than gender inclusivity. And for various reasons related to social cultural dynamics, for example, related to understanding what, for example, some of the health needs are of certain communities, et cetera. But one example that I would give, and I think this question came from Fiona, and I placed it in the chat, is that UNICEF was supporting the government to implement a cash transfer program that specifically included a component targeting LGBTQI+ populations. And that included different techniques for being able to identify populations because of marginalization and because of fear of reprisal and attack. It included consultations with LGBTQI+ populations to understand what some of the needs they faced were in terms of accessing cash, barriers to cash, in terms of, for example, safe spaces, accessing agents that wouldn't discriminate, agents and locations that wouldn't harass them, for example, areas where they wouldn't necessarily have their identity disclosed, et cetera. And that's been quite successful. So I'll try to drop a link in the chat after this, if that might be helpful. I don't know of a particular example around sex workers, but that I can give on Lebanon for LGBTQI+ populations. There were a few questions, I think, around challenges to the fiscal space, and I'd love to hear what my co-presenters also might say to this. And I think there are a number of ways of looking at this. There's no necessarily straightforward and easy answer. If so, we might be doing a lot more in this area and arena. But I would say that there's a few techniques that have been demonstrated to be successful, including looking at some of the long-term gains and costs of inaction specifically, recognizing, for example, the cost of not having maternity benefits in everything from health outcomes and impacts for children, which then, of course, produces greater costs for a government over time, especially for national healthcare systems, looking at the loss in productivity to the labor force, specifically by losing the labor participation of women due to lack of access to maternity benefits, looking at the long-term human capital development sort of depreciation effects from not having both maternity benefits and child benefits, for example, in place, and then thinking about the intergenerational transmission of poverty that I had mentioned earlier. And so in many cases, building the evidence base around some of these costs of inaction actually demonstrate how the costs of inaction are significantly higher than financing some of these gender responsive approaches. Another piece that I would mention related to financing is actually thinking about this less on a scale of magnitude that tends to dissuade governments from engaging, and thinking about it in a very sort of piecemeal and graduated fashion. So perhaps in certain countries, beginning with a maternity benefit that's provided to a segment of the population, and then gradually moving towards that notion of progressive universalism and progressive realization of further benefits, beginning with a maternity benefit for pregnant women, expanding to a maternity benefit for pregnant and lactating women, for example, then moving to include a child benefit. It may begin as a child benefit for the first 1,000 days, and then move forward to be a child benefit for children under 2, children under 5, and so forth. So there's sort of this graduated approach that can be applied, which also builds the very contextual business case, as well as evidence base for these approaches for government. So that is also one way of approaching the financing, not necessarily thinking of it as an entire system that has to be an entire robust system of benefits that has to be in place, or entitlements. The third that I would mention is around cost sharing. Cost sharing, yes, from individual contributions, of course, through tax revenue, but also cost sharing from employer generated tax revenue. And I know this is something that our colleagues at the ILO have worked extensively on, and UNICEF's Child Rights and Business Engagement Unit has also worked as well on looking at where innovative financing can be drawn from sort of mutual cost sharing structures that contribute to these contributory schemes that can be offered to a population. Again, a lot of that has to happen on a graduated process, which requires moving from high degrees of informal sector work and informal economy more towards a formal economy. But there are ways to even apply this looking at the informal sector as well through taxation benefits and so forth. So I would just give those as 3 talking points related to financing for gender responsive social protection, and then one overarching comment. And I only spent a little more time on this topic because I know there are several questions to this. But one other overarching comment is also recognizing that within the benefits and entitlement structures in the social protection system, there are ways to tweak those to make them more gender responsive. It doesn't necessarily mean implementing an entirely new benefit or an entirely new entitlement in some cases. It may mean tweaking the way in which a certain entitlement or benefit is delivered, or to whom that entitlement or benefit is delivered in an existing social protection scheme. And then I believe lastly, there was one question related to NGO support for this type of work. And I think there's quite a few things that NGOs can do. One is that NGOs have significantly contributed alongside UN agencies to building the evidence base and to ensuring that there is a robust and contextually relevant evidence base. And even more so to ensuring the knowledge dissemination from that evidence base on what works and what doesn't, and what are challenges, et cetera. I think NGOs have a significant role to play as well in advocacy and in emboldening especially local civil society around advocating for these types of benefits. I think there was also a question around how NGOs can help people become more aware of their benefits, for example, through community sensitization campaigns, information campaigns, supporting even with grievance response mechanisms, for example, especially because many NGOs and local civil society are far more locally rooted in some ways, sometimes even more so than a national government. And then last, I would say working with local governments. I think that is actually a significant role that NGOs can play because local governments actually are the arm of implementation for any of these national policies. And in many cases, sometimes the policy is divorced from the implementation when local government isn't more effectively involved, and local government isn't also taking ownership and responsibility for ensuring that these entitlements are reaching people. So I'll stop talking there. I apologize for the additional time.
No, thank you. Thank you so much, Lauren. Now I would like to invite Shana for her response, but I would like to add one additional question. You have said rightly that in Kenya, social health insurance is a legal requirement for the entire population. However, you said that men in the formal sector and the workers and employers are opposed to women maternity cash benefits. What are the practical strategies to overcome this challenge? Please go ahead, Shana.
Yes, thank you. I think Lauren already made like all the points that one can make, basically. A really excellent overview. So I'm just going to add like tiny portions to it where I could fit in still. So I think first of all, what you said in terms of progressiveness, I think we can see that in a lot of countries. No, these benefits really start very, very small, like South Africa, the child benefit. It starts like with the first 2 years, and it really takes 15 years to scale it up to a proper child benefit. And I think this is something where often we go in also maybe too strong with these, and also governments sometimes set the bar too high. And then when they look at the envelope that they're facing, they're really, shocked, and then they stop. So it's much better to really start sometimes with a maybe lower benefit or lower segment of the population or lower eligibility criteria, and then scale up because very often it's just not very affordable otherwise, especially when we look at contexts here in Eastern Africa. Then again, I think the question on have certain aspects been costed is very difficult. Yes, certain aspects have been costed, but not, I think, as a whole. So of course we know that, for example, the most dangerous thing that a woman can do is give birth. So, and we know how essential and crucial these first years of life also are for kids. So there is, of course, a lot of costing around like maternal mortality and what it means economically. There's also costings around, for example, absence of exclusive breastfeeding. I think UNICEF estimates that it's around 0.7% of GDP globally if you just look at the absence of breastfeeding. So there's all these costings, but I obviously don't have all the numbers in mind. In addition to the part on local governments and so on, I mean, what you've also raised as a specific question to me is exactly that I think it's quite important when we look at contributory schemes and looking at maternity income protection, for example, that we really engage with employers and unions and government very early on. I think there is just often also a cultural barrier that men don't really see why they should contribute to something that will only benefit women. Although, I mean, it's their wives that will benefit from it, but still, it's sometimes a bit funny. But so I think that's very important, and it's really important to engage with this tripartite structure that ILO works with, because if we look at social protection mechanisms in a lot of countries, and I'm sure that Nakalo can also say that about Uganda, same for Kenya, employers and unions are opposing very often those progressive social protection policies. So they have to be really consulted very early on and brought on board. So yeah, I think that's the main thing. On the NHIF part, that it's become mandatory. Yes, it's a very interesting development, but we have to say it's also only since January this year. And then the question of enforcement already comes into place. No, so we have this problem with a lot of benefits in terms of people might be legally entitled. It's the same for paid maternity leave. Women might be entitled to it, but if it's not enforced, and it's then it's kind of difficult to count it as a proper social protection mechanism. So the same goes for the NHIF mandatory nature. At the moment, it's not being enforced so far. So I'll end here and hand over to, I think, one of the other speakers.
Thank you, Shana. Nakalo, please take the floor.
Sorry, thank you very much. Just perhaps to compliment Shana on Uganda, we have the biggest part of our population in the informal sector. And like she says, rightly so, I think engaging employers right from the beginning in the conversation is really key, because this is really a cost that many do not want to actually take on. But maybe to address a question that was raised on the Urban Social Protection Program in Uganda that I presented, This is still donor funded, not government funded, and it's a pilot that started in 2019, with phase 1 having been funded through the EU joint action on linkages with social protection and public finance management. But in phase 2, which we are implementing right now in the scale up, this is being funded by the Belgian government. I'll stop there for now. Thank you.
Should ask, once there is those program funded by donors, how about their sustainability? Maybe I'm raising that question once again to Lauren, to whom I would like to ask again this question. Can you share with us one or two good best practice where gender social protection responsiveness has taken into account intersectionality of factors of women vulnerability, inclusion of women, child-headed household, elderly women, people living with disability, migrant and indigenous people? Do you have some really concrete good example, good best practice that you can share with the participants here? Yes, Lauren?
Sorry, I couldn't reach my button. So the first question was around sustainability, and the second question was around best practices with intersectionality. Is that correct? Okay. So I think a few things, and also again, would be happy to hear from colleagues as well on what your thoughts are around sustainability in particular. I think we often fall into this sort of vicious circle or trap whereby we have a lot of donor-funded pilots, programs, excellent programs, exactly like what Alan was just mentioning. And then we fall into a place where we have significant difficulty getting that uptake by government, getting the scale that we would hope to see beyond the pilot stage, et cetera. And I think there's a few examples where we've found that there's a pathway from piloting to sort of integration, adoption, and scale that can be successful for sustainability, but it also has to be something within reason that a government can do and take forward. So for example, to what Shana was mentioning before, starting smaller and growing bigger, maybe there's some aspirational approaches to certain pilots that we want to see scaled, we want to see integrated and adopted, but perhaps can't be at the outset. And therefore, it might be that a pilot establishes the greatest potential to which a program can achieve. However, we start at a narrower subset of that and work towards it. One example that I think of is the longstanding work that UNICEF has done in Madagascar to secure the child grant there, which the government has taken forward. And that was a significant period of over years of advocacy and of implementing child grants directly, but then working with government around the budgeting and the financing for that in particular, so that that could be then taken on by the government and scaled nationally. Similarly, I would say for the example I presented around Mozambique and the cash and care pilot, that was something where government was included from the very beginning, which is essential to moving from this, sort of pilot pathway into scale and adoption. Government was included from the beginning. Public finance costing was done with government from the beginning to see what would be actually reasonable that they could do. And then there were attempts to leverage inputs even across different ministries. So for example, looking at community health workers who might be specifically funded through the Ministry of Health and not necessarily a Ministry of Social Welfare or Social Development, but can be leveraged to be able to provide certain forms of training on nutrition, for example, or who can be leveraged to provide certain sort of access to health services that populations wouldn't have. So some of that requires some creativity, but keeping these things in mind at the outset when launching a pilot so that there's a greater chance of that pilot being able to be meaningfully adopted and operationalized, I think is very important for the long-term sustainability. Honestly, we all know that there are struggles around sustainability, especially with dwindling donor financing, and especially I know many colleagues have spoken to the effects of the Ukraine war on financing for programs, which creates a lot of tension and concern. And so we're looking for more innovative ways of approaching these programs so that there will be some sort of a substantive financing base for them going forward. I won't presume to have all the answers to that. And I know there may be colleagues who are on the line who also might like to speak to it, but I think that's one thing to note. And then just quickly on the best practice with intersectionality, I think one example actually comes to mind a few examples perhaps, but particularly thinking about the example that I shared from Ethiopia, when we're looking at the intersectionality of newly internally displaced populations as well, and their integration into PSNP. And that was done largely because of the shock responsive preparedness of the PSNP program to be able to expand horizontally to add additional populations, recognizing that there were going to be particular needs for those who may face some sort of a shock around migration, in this case, internal displacement due to conflict. So that might be one example for intersectionality. Another example would be in Yemen, where the program specifically, where UNICEF was supporting the government to reach out to populations that were experiencing extreme poverty and vulnerability, and particularly to tailor the approach to those populations who actually were inadvertently excluded from social assistance programs. And so recognizing the intersectionality of deeply entrenched poverty, as well as social exclusion and marginalization of those populations. So something akin to what we might consider the Dalit class in India, for example. That is the grouping in which those households fell. And then UNICEF was able to support the government to actually reach these populations, consult with these populations for what their needs were, and then integrate them into the national system. So I would give those as two examples on intersectionality. And if there are others, I'll put them in the chat.
Can I come in and just add one point to that?
Yes, Nakalo, I'm sorry.
Thank you. Thank you very much. Just something small on sustainability and the question on such programs being eventually led by government. Now, our experience in piloting such programs in contexts where social protection is not very widely understood or appreciated is such pilot programs provide an evidence base that social protection is key and the benefits that it has on the population, the demographic dividends that it has, especially for the younger people, the investments that we make in social protection. And we are beginning to see in Uganda that it's unlocking very important conversations and discussions within government, even in the design of the strategy, but also in terms of, a program does not have to be scaled up or taken up by government as a whole. There can be different aspects that can be borrowed from an intervention that can be integrated within government, depending on affordability. Lauren talked about affordability for governments, and that's really key because when they see a program that perhaps is very costly, this really puts them off. In Uganda, we have the National Social Protection Program for the old age grant, and here people get about $7 per month. When you look at an intervention where perhaps it's $10 or more, they might be afraid, but there are certain aspects that they can implement and integrate. And we're beginning to have conversations where they're saying, how can we make a case to design a disability grant, for instance? And they are putting funding in an incremental way to such small child-sensitive social protection interventions, but it's building the case as well for social protection as a whole. But also, it's okay to start small, and that's what donor-funded interventions such as this is able to do, is to unlock the potential and also the evidence base for government take-up of these interventions. Thank you.
Thank you so much, Nakalo. Shana, there is an additional question. Do you see social protection as an expenditure or an investment? This is the additional, then you can make general comments before we could close up our webinar.
What would happen to my job if I would now say this is an expenditure? No, I definitely see it as an investment. And I do think that even governments in the region by now do see it as an investment as well, but it's still hard to create fiscal space, even if you see it as an investment, because it is just limited in a sense, as we are seeing it right now. But it doesn't mean that they don't see it as an investment. And I do think that, for example, with the maternity benefit, what we really appreciated was that this idea didn't come from us. It didn't come from the donor groups or anything. It really came from the National Health Insurance Fund, that were thinking about how can they make it more attractive for people to join NHIF. So they came up with this idea of having a cash benefit for women. So I do think that these processes, especially when they come from government institutions, employers, unions, wherever they come from, on national level, they are much more fruitful. In terms of sustainability, I do think that we have seen in other countries that you can start with donor funding if you have a quite clear agreement with governments that they will take over time. So what we do often see is those pilots that Nakalo also described, and I do think also the child benefit here in Kenya, that can prove to the government that this is functional, that this is feasible, this is a good investment, but it needs an agreement, of course, over time that it will be taken over by the government. And as a person who mainly works with refugees, I mean, it's much easier to argue with governments that they will do and implement such a benefit for citizens than for refugee populations, for example. So these discussions are, of course, not easy, but there is a certain reasoning also from governments that they see it as an investment by now. So yeah, it's not simple to say it's just an investment, so governments should do it, but we hope that over time there's also generally more investment in social protection because it's falling very short. I think in Kenya it's below 0.3%, so it's really low in terms of GDP. So there's also, in a positive note, there's a lot of room for improvement and expenditure on social protection. So we hope to see that in the next few years. So I'll stop here. Thanks.
Thank you so much. I think we have exhausted all the questions that have been asked. And then as concluding remarks, I would like to say in conclusion that we thank all the participants for your contribution. You were very many, about more than 110 people. Thank you for your participation. Many thanks also to the presenters for their contribution during this webinar, and what they have shared is really important, particularly in terms of national experience sharing. What can we take away? First of all, we do recognize that social protection is a human right, but not all the segments of society benefit from it. Women still enjoy significantly lower social protection than men due to several factors, including higher part-time, temporary, informal work, gender pay gaps, unpaid care work, and other prejudices. Social protection is recognized as a fruitful investment, both economically and socially. Therefore, there is a necessity for adequate, affordable, sustainable resources for financing gender-responsive social protection. Presenters have put emphasis on progressiveness also, given the capacity to have a comprehensive scheme. To achieve this goal, there is a dire need for better public finance management, better budget allocation and governance through a multi-stakeholder approach, including the government, economic actors, trade union through what is known as tripartism, and civil society organization in an institutionalized dialogue in policy-making processes, monitoring, and evaluation. On behalf of the ILO, UNICEF, and the Global Coalition of Social Protection that I represent here now, we would like to express a special thanks to the EU, our funding partner. Through close cooperation, we can make the world a better place for all. On this note, I thank you all and see you next. Bye-bye.